Welcome to our Istanbul Policy Center's new webinar. My name is Ümit Şahin. I'm the coordinator of climate change studies at Istanbul's Policy Center, Sabancı University. And I'm working on climate policies, but also as a medical doctor and a public health specialist, I'm also working on the impacts of climate change, and especially on the heat waves. And so we are experiencing quite hot days in Turkey. So once more, we would like to talk about heat waves and health effects of climate change. So I'm delighted to introduce my colleague and a new visiting senior fellow of Mercator-IPC fellowship program at Istanbul Policy Center, Dr. Pierre Gosselin. Welcome, Pierre.
Hello, how are you?
Thank you, and very good to have you in this webinar, and also as our visiting senior fellow. Before starting the event, I'd like to say something about Pierre. Pierre Gosselin is working at the Quebec Public Health Institute on climate change issues in Canada. He coordinated the joint Kronos INSPQ research program in climate change and health from 2004 to 2019. He was also in charge of the health component of the Quebec Action Plan on climate change and remains involved in several projects. Pierre, we hear some noise from background, but
well, I don't hear anything. So is it okay?
Yeah, now it's okay. Yes,
it's okay. Okay.
Okay. So Pierre is clinical professor in preventive medicine at Université Laval and associate at the National Scientific Research Institute. And he was trained as a physician at Laval University and in environmental health at University of California at Berkeley, and has been director for 22 years of the WHO World Health Organization's Collaborating Center on Environmental and Occupational Health at the Quebec City University Hospital. So we also worked together with Pierre last year about Istanbul's heat waves and the mortality related to heat waves in Istanbul, together with our colleagues from Cerrahpaşa Medical School, Public Health Department. I'm very happy to have Pierre today to talk about battling heat waves in hospitals and the community. So Pierre, now the floor is yours. He is going to give us a 40-45 minutes presentation, and after that we will have the questions from our chat screen. During the presentation, all our participants can also write their questions directly on the chat screen. Okay, please. Yeah.
Well, thank you, Ümit. I'm very pleased to be part of this program. So let's start right away with the presentation that I've prepared for you. It's called Battling Heat Wave in Hospitals because that's where sick people are and shouldn't die from heat waves because they're being treated for a disease or a surgery, and also in the community because that's where many people die in several instances during heat waves. Now we're suffering some heat waves, but in the future it's going to get much worse, and you need to be aware of that. I'll take a few minutes to, for those of you maybe not familiar about climate change mechanism, just a quick overview, and then mention the social and health-related impact of climate change. Social because when you're suffering an extreme meteorological event, you lose your job, you lose your home sometimes. Health, of course, we'll focus a little bit more on that. I'll mention Canada because that's where I've done most of my studies, and focus on heat and heat waves because that's Ümit's main interest. What about solutions and priorities and positive spin-offs of adaptation against climate change. So that will conclude the presentation. Climate change is very simple. It's about average changes. So the planet is warming, and extreme events changes. Any type of extreme event is likely to increase in frequency, increase in severity, and that includes, of course, and foremost, heat waves. That's because the variability of the climate increases with warming. It's like heating a pan of water over a stove. At the beginning, it begins to be lukewarm water. After some time, it's very hot. And after some time, you see the bubbles of boiling water. We are at the hot stage before the bubbles, but bubbles are coming. So it's really all about heat and water. Here we see my country, Canada, just north of the United States. And our Ministry of the Environment has accumulated the average change in temperature over the last 70 years. So since 1948. And you see that the US has warmed less than Canada at 1.7 degrees Celsius. That's because more warming is taking place at the northern latitudes. You see also that, which is here, you see a warming of 3.5 to 4 degrees already on the continent. In the east, where I live, we're being cooled by Greenland and the North Atlantic Ocean, which is why we don't see that much warming on average again. Precipitation is the other key factor. Here we see that we're lucky, not much change, except in the north. The north usually didn't receive snow or rain much, much lower than us in the south of the country. And that leads to accelerating the thawing of permafrost, which means that winter roads and buildings are just crumbling because they don't have anything solid under them. What we see also, if we get in averages, is that what I'm talking about, the preceding slides, is about that part of history, and that the next part, the projections using the climate models, they're really going up rapidly. And you see the different colors here. The red one is the track we are currently on, which is increasing CO2 in the atmosphere. So the next stage, the next 30, 50 years will be really rough for most people worldwide, not only here. The extremes is going even worse because you see the previous period was quite, flat, less variability. That's what's becoming to be seen here. For instance, we had something like 10 heat waves between 1980 and 2010. Between 2010 and now, we had one heat wave, maybe two, every year. In this current year, we started heat waves in May, which is quite unusual, and we are currently at the fourth one in the year, which is completely unexpected. What's interesting in events, hazards of interest with the climate change is that all extremes are going to be more frequent. That includes heat waves, but we shouldn't forget that cold spell will still happen. That is going to be less severe probably in terms of cold, but as we get less accustomed to cold, health impacts can be very huge. The storms in general, any types of storms are important. The floods will be important because we see what we call a tropicalization of precipitation worldwide. So during the summer, you alternate between periods of droughts and periods of very abundant precipitation. Wind will be extremely important, and most of our buildings aren't meant to withstand extreme winds. Droughts with impacts on agriculture, forest fires, landslides because there's too much water happening suddenly. And what we begin to see more and more is all these things happening at the same time or in a cascade. So we've seen that just last year here. A huge flood that lasted about a month, followed by 2 weeks of heat wave for the same people. And then a bit north, we had important forest fires that brought increased air pollution for another 2 weeks. So those poor people were exposed to some form of extreme for 2 months in a row. It's difficult not to suffer physically, but also mentally when you get such problems. Worldwide, we see those extreme weather events multiplied by 3 over the past 35 years. Those are events with losses, so any kind of loss that can happen, loss of life, loss of homes or buildings or whatever. As a comparison, we've got the geological events here, the earthquakes. They haven't moved in the last 35 years, but the rest has increased dramatically. Variability is something normal in the climate. Here we see the variability during the last month of June. That's produced every month by NOAA in the United States. You see that Northern Europe was quite hot. Well, just beside in Central Asia, it was rather cold. And meanwhile, Siberia was burning. In North America, cold in the west and rather warmer in the center. It has completely changed since. I mentioned this because it's normal to see such variation. What about Turkey? And I thank Ümit for sending those information. What's interesting to see is the fact that in just a few years ago, 2007, using the climate model of that time, the projections for the period towards the end of the century were 10 to 30 more heat wave days for Turkey in basically 50 to 70 years from now. And a recent similar study done by your meteorological service has shown quite different matter. The problem is that we've continued for 15 more years to emit CO2, and the number of heat wave days per year is now expected for the same time frame to be between 27 and 204 days a year. That means 6 months of hot weather per year. And the other thing is that most of it will be already there in 20 years from now, except for the coastal areas, of course. But you see that the regions near Istanbul are going to be just orange, so that just a little lower than the rest of the country, which of course is not cooled by the sea. So it's something that will happen in no time. Less than a generation, that your climate will be extremely hot, more than it is now. It's a very rapid and huge acceleration. It's seen in most parts of the world, but it's only with the recent data, the recent modeling of climate, and the fact that we've continued emitting CO2 that we see that happening. This is the latest measure at the Mauna Loa Observatory in Hawaii. When I started working in climate change 25 years ago, we were in the 300, low 300. We're now at 417 ppm. This is the longest standing observatory of CO2 in the world. So we were supposed, with the Kyoto Protocol, to reduce down to the level of 90. We were supposed to begin reducing around here. We're just up. What are the social and health impacts of climate change? Important notion is that it's physical, but it's also mental. Even if it's just one heat wave, we've done studies and we show that up to 20% of people feel that they have mental health problems during and after a heat waves. And as I mentioned before, social impacts can be important too. Physical problems can be quite severe. Here we've got there's a world database that is maintained in Belgium, and it shows that here we got 2 years, 2010 and 2011. Some countries do suffer from more disaster. Orange and purple is the United States, Siberia, Russia, China, India, Australia. What we see on TV is really happening for real. Some countries receive more than their share. Mortality, though, is not the same. It's lower in some countries. United States has a lower mortality than, say, China or Russia for a similar amount of disasters. The number of people affected, though, is quite high in the United States or in China or Brazil, for instance, meaning that some of those differences are not linked to the events themselves. Some of those differences are more related to how you respond or you're prepared to such a situation. Here, we got people affected by heat waves over the last, from 2001 to 17. You see that lots of people were affected worldwide. This is the 2003 heat waves in Europe that boosted the zone, the European zone. But not many people died in the Americas of that. A lot in Europe and a lot in Russia, as you can see. Much less in India. So maybe we have something to learn from India about battling heat waves. I don't know. This is about floods. Again, floods everywhere on the planet, but again, better preparedness, better resilience, better ability to respond than India. Maybe India has something to learn from us on battling floods. I don't know. So these variability need to be taken into account, even at the level of a given country. Also, to take into account the prior vulnerability of the people and of the infrastructure in a given country. If you're not well organized in terms of communication, or if your population is old, aging, that will impact them much more than in some other country. This brings us to the notion of risk. You can be exposed to a hazard, you can be vulnerable, and if you're exposed, you'll have a high risk. But again, if you're not exposed, even if you're sick and old, if you have air conditioning at home and stay put at home, even if there's a heat wave, you won't have, you're not exposed, therefore you have no risk, no health impact. So it all depends on socioeconomic processes, how you organize the governance of your country, of your region, what you've done to prepare yourself, and the natural variability and climate of your given region. Who are vulnerable to heat, or basically it's the same for all extremes. People dependent on others for daily life, disabled people, some seniors that are not fully in health, people who are chronically ill, and I would say at any age. You can be 40, but if you've got severe asthma or a heart problem or diabetes, you're at high risk, probably. Low income and homeless people, because they don't have the resources to address those hazards and exposures. And people living off the land, and here in Canada, we have plenty of indigenous residents, especially in the north. We call them First Nations. Farmers are quite dependent on the weather and can suffer more than others. So it's the accumulation of those vulnerabilities and exposure that will worsen the impacts. The direct impacts of health on health, of course, it depends on the hazard. A heat wave will directly impact the body, the level of hydration, your heart, your lungs. And so that's a very direct impact, like UV on your skin is a direct impact. However, most of the impacts are indirect. It's much more important because in the end, if your water quality, the air quality, if your food production is decrease or poorer quality, it will lead to important health impact. Basically, the types of health impacts, there won't be much new diseases. Some infectious diseases come from the south and go up north, or the other way around if you're in Australia. But basically, it's the same basic, most frequent cardiovascular diseases, respiratory diseases, and infectious ones. On the indirect side, malnutrition can pop up at some point. You can have some effects on pregnancies and births, premature births and stuff like that. But basically, the known health effects, the known mental health effects, including post-traumatic stress, but also when you're caught in a severe hazard, flood and heat wave, you can drink more, you can take more drugs, more prescription drugs, and in the end, it can be a huge health impact on the mental side. Air pollution doesn't disappear because of climate change. It will even be increased by climate change, depending on where you are, what's your industrial setup, what's your level of car traffic. It can go up to 40% more ozone, more PM. The current situation in Canada is examined every 2 years, and we've got, using very strong systems, we can estimate at 14,000 premature deaths. That means deaths before the age of 65. Our mean annual levels of PM being at 7 microgram per cubic meter, and Turkey being at 42 microgram per cubic meter. It means I haven't seen those numbers provided in the literature for Turkey, but it's huge. It's probably in the 70, 80,000 premature deaths per year. That will be worsened by climate change. So there's some work to be done here and in Turkey too. Air pollution includes pollens. We currently are seeing worldwide an epidemic of allergies to pollens. It can be hay fever, so a simple upper respiratory tract allergy that can be quite difficult to bear when it's important, because there's fatigue that adds to that. Can have asthma attacks. You have to increase your medication. Basically, the numbers have doubled over the last 20 years. We're close to between 15 and 20% in Canada, United States, Northern Europe, where we can see those studies being done. Apparently, there's no data for Turkey, so maybe that's another component to be worked upon in the next years on the air pollution side, because climate change is really the main driver behind that increase in pollens everywhere. It's like a very potent fertilizer, and the growing season is increasing too. Heat waves are big killers. We've seen that on the news in 2003. Here in Canada, it stimulated the setting up of warning systems. And the main subpopulation impacted our seniors. Not everywhere, and it also depends on the intensity of the heat wave. Why seniors? That's because they accumulate very often several chronic diseases. They take medication that are increasing dehydration, for instance, or can make management of heat more difficult, like if you're diabetic. Here you see different cities in Europe, and the levels we see in a light heat wave doesn't last too long, not too hot, let's say 32, 33 degrees, lasting 4 or 5 days. You see excess deaths in that population of about 10–15%. When it's longer, like you see here in Paris, in long duration, high intensity, so you get into 35, 38 degrees, you see a 30% over mortality for that 2003 heat wave. It lasted very long, so many deaths, but it's only 33%. We had the same in Montreal in 2010. As a point of comparison, the COVID pandemic currently in France, they just calculated a 60% over mortality for the period of 2 months at the peak of the epidemic. And you see some other, depending on the mean age of the population. Milan is quite high here. It also has an air pollution component that's worse than elsewhere. Barcelona is known for bad air too. So you see the kind of differences this brings. But here in Canada, we haven't seen there. Many young people are dying in Montreal and Vancouver. So we don't know why exactly, but we don't see that much difference in terms of deaths. Warning systems have been implemented here and there worldwide, maybe 15, 20 systems are in place, and they've been evaluated for their effectiveness, and they really reduce, importantly, just warning people and having some help in place and mechanism in place can reduce by half the number of deaths and morbidity too. The most impressive one is in Bangladesh, because it has really reduced significantly the impact of heat waves over there. But basically it works. And here are the number of studies. It's exponentially increasing the number of scientific papers published on those topics in the last 10–15 years. Some of the improvements are linked also to better medical treatment for cardiovascular disease and respiratory diseases, and availability of air conditioning. Of course, you see that here in New York City. That's an interesting study spanning a whole century. New York City had a good health department back in the 1900s. You see the levels of deaths, cumulative relative risk for some temperature in the 20s and 30s, and then dropping in the 70s, which is the beginning of relatively cheap air conditioning in the US. Again, cheaper here. Maybe they began to make them in China, I don't know. Here in the 90s is a better medical cardiovascular treatment, new drugs, new surgical interventions, and continuing being more available, and air conditioning, of course, increasing all the time. So you've got several aspects to take into account. But it's gone be worse in the future. I told you about the weather, about the heat waves. Here we see a projection based on the current state of affairs in 161 cities done by Antonio Gasparini a few years ago. And it includes the data from all these countries. The worst, you see that it's better in the north because it's usually shorter in duration, less intense, and worse in the south. And here you see the worst parts where you see a 10 to 15% increase at the end of the century in deaths due to heat. The blue ones are the decrease related to cold spells, but it doesn't compensate at all. Here you've got Southern Europe, of course. I believe Turkey would be nested in that region. And the last column is the worst because it's the current state of affairs in terms of what we call RCP 8.5 scenario, which is the if we continue emitting CO2 gas as we do at the present time. So it can be reduced if we emit less, like here. But if we're based on the assumption that we continue to do as we do, that means 15% increase. Other diseases I mentioned, the preceding one is about all-cause mortality. So it includes some infectious disease mortality. Diseases like dengue here will go up north. It will go in places where it was before, but it's been eradicated. So going to, it's already under surveillance in southern France and in Spain. Also the same in Florida and south of the United States. And I believe it could reach your country at some point also in 2050, around 2050, or even before that, because those studies were done with the old climate models and will need to be updated. Same for West Nile virus. Because the north is getting warmer and will still have water, it's going to increase dramatically in the north. So in short, we have very significant impacts everywhere, especially because of the lack of ability to respond in more economically vulnerable countries everywhere. And even in the rich countries, in poor neighborhoods and regions within every rich countries. Exposure depend, of course, it's quite variable, but coastal areas accumulate more risk altogether because of the storms. Of course, the heat waves, but maybe less. But the storms, the floods, and eventually being flooded by the rising seas. What we saw also in Southeast Asia about the high risk of mortality with heat is related to the fact that when it's 50 degrees and 52, like we've seen in India last year, I believe, you're exceeding human physiological limits. Nobody can adapt to that. So if you're stuck with being outdoors or at home for several days, at some point, many people die. What are the priorities and solutions that can be implemented? Of course, that will vary on your risk in your region. Here we see several cities within Canada spanning maybe 2,000 kilometers from east to west. You see that some cities won't be that affected. 30 days of very hot weather during a summer is still bearable. But when you're here in Windsor, which is in southern Ontario, and you see that all summer, it's a little bit like what I mentioned for Turkey in a few years from now. All your summer, many months in a row, very hot, your priorities will be different, that's for sure. Here we see Montreal, close to my home. We will go from 10 days a year of hot weather, which was the past, to something like 50 a year, which is again 2 months of hot weather in just 20 years from now. So everywhere we are in this country, we triple or quintuple the number of days. And again, that's a huge acceleration compared to what we had as projections just a few years ago. And even if you go north, I live in Quebec City, where nobody has air conditioning. It's about 40% of people have air conditioning compared to 75, 80 in Montreal. Is going to be needed pretty soon too. Depending on your point of view, also priorities will change. If you're a practicing general practitioner, emergency physician, when it's hot, you know heat stress happens. You know you'll have some heat illness. You'll try to remember what it means in clinical science and treatment, and you'll eventually treat your patient. And what will bother you is access to treatment to avoid deaths. When you check that from a public health point of view, all those factors I already mentioned, this prior sensitivity related to age and health condition, where you live and what access do you have to resources that can help you go through a heat wave are important, are action point. The adaptation in terms of education, eventually urban design, trees, accessibility to parks, density, all that become important within an action plan. Being in good physical shape is also important. And one of the main ingredients is good access to food, to good food. And food insecurity is something that is important to measure too. You see here in Canada, that's an old study, hasn't been repeated, but it will be in the short term, that normally food insecurity is around 7 or 8% in the country for most people. But when you go to Aboriginal indigenous peoples, it goes up quite rapidly. Here we are in the northern part of the country where everything goes by plane, not much is grown locally, and the game is disappearing. The birds and the whales and all the things that they use to hunt are declining dramatically. So you see huge differences in terms of food insecurity. Also a gender difference in some of those nations, 16% for men, 26% for women. So you cannot be in good health when you have those levels of food insecurity, defined as moderate or severe, which means that you're hungry very often. Where you live is important. The notion of urban heat islands is there. Depending on where you live, you got trees or you got less asphalt, less concrete, and it can be huge difference in a city between a park and a parking. Let's say you can see 15 to 20 degrees difference just side by side. So it does make a difference when you're indoor or outdoor. Here we did those maps for the whole province, and we can see then where you're low income, the most disadvantaged, the most deprived regions, what we call the fifth quintile, all those people live in urban heat islands. So it's hotter there than in the good neighborhoods with plenty of trees, where it's really quite different. You have access to much more tools here to battle a heat wave than you have here, that's for sure. These are studies that we did throughout the province. They were done also in other parts of the country. During a heat wave, the number of people, we've done those studies 3 times, the number of people that perceive a physical impact is huge, around 45%, 40, 45. On their mental health, 18, 20%. With some others, and just fatigue that I mentioned a little earlier, about 15%. That has a huge impact. 12% of those people go to see their doctor or pharmacist, so it's a huge cost for the health system. Here we are with some priorities to determine for Canada that we have some consensus upon. Needs to be done in each country, in each region of each country. And also the impacts, indirect impacts about migrations. We surely have something to learn from Turkey about handling migration. That's something we don't really know. Some social unrest, some psychological problems in the young people, seeing a bleak future. So that's all topics that need to be addressed. So what do we do in terms of adaptation? You have to prepare for emergencies. You have to try to reduce vulnerabilities in people and systems, to reduce exposure, and to organize your governments, to different level of governments to implement all that. What I also like to say is that we should give hope by offering some solution, not always talking about problems. And the job of public health is not to help the rich, it's to protect the most vulnerable and the greatest number of people. This being said, we implemented about 10 years ago surveillance and warning system. It needs good data to begin with, of course. It needs some ability in GeoPortal, in geomatics in general, using cartographic and integration tools. But it works very well. It's a very good common tool to organize public health response. We also, to identify what regions, what really parts of what cities are at risk, we have information from the census. We update that regularly, but we have housing condition, age, population density, a deprivation index, based on several indicators. Also we take into account the foreign language, because people don't necessarily watch the same programs on TV, depending on their language, basic language. So you need to take that into account to be effective in your messages to the general public. We follow in real time or quasi real time deaths, hospitalization every day, visits to the emergency room, ambulance calls, and also calls to, we have a service offered by the government where nurses can answer your questions. So we follow all that on a regular basis. Every time there's a hazard, extreme meteorological events that's planned or on the way. We have done maps for Yubinite Island for the whole province, because you find them not only in big cities, but in every small village. There are spots where you can be hotter. It can be hotter than the rest of the village, and people are therefore more exposed. One of our priorities, besides setting up emergency systems, was to develop some greening projects in pilot greening projects to see if we could improve those areas. We put a lot of money, 43 billion over 7 years, and we asked from contribution from the municipalities and the local groups, and it worked very well, very good. You see, the principle is simple. You keep the water in the soil, you plant trees, and also the roofs. You put reflecting roofs, white roofs, basically, or green roofs. That is very useful. The Ministry of the Environment of Canada has evaluated the effectiveness of doing that, and in the areas where we did that, the average temperature can be decreased by 2 degrees, which is enough to offset completely over mortality during a heat wave. So it's a very interesting approach that is known to be useful. Some of our friends were the half-fat, what we call half-fat lumberjacks. So removing asphalt is a good civic action to reduce heat within a city. That's the joke we wanted to share with you. The province of Quebec has taken this approach compared to other provinces in Canada to address all those risks at the same time, or more vigorously, more aggressively than the rest of the country. And it's one researcher from McGill University did an independent evaluation and told us we were doing it right. So that's a good tap on the shoulder. We continue to improve our act in developing observatory for zoonosis because it's going fast. You need to have competent people to check that. We also believe behavioral adaptation are important. We recommend people to do stuff, to do things, to change their act, but we don't know if they do it. So we do surveys, regular surveys from time to time. We are now at 15 different surveys on different topics, adaptation to floods, heat waves, Lyme disease, that kind of stuff. And we are updating, of course, our surveillance system. We also believe that knowledge transfer and mass communication are important. So we, besides going on TV and in the papers, we have developed our own web media to present positive and useful actions that have been developed in the region. So there are videos, short papers, is going on the social media. We've got website, of course, and we have begun training 5 years ago for doctors, for nurses, and we have short ones and longer ones. We did the textbook and developed a MOOC, massive online open course, recently broadcasted. So we have 20,000 participants. So it's a good success. First such course that shows the full spectrum of what is climate, what are the impacts, what can we do to adapt. Basically, we're continuing the greening and urban development adaptation. It's going in several cities now. We hope to have more money pretty soon. In September, the government will announce a new plan. We are also doing regional within the province of Quebec. So these are small areas, about between 500,000 and 1 million people. They have an adapted plan because there's a big diversity in risk in those changes. We have nested that within our public health plan for the province, and we will begin cost-benefit analysis in the short term. So at the present stage, we are what we call the mainstreaming, where you should put climate and health-related concerns in all government and business decision. We have plenty of information of scientific studies. We need to update ourselves constantly on that. We will continue to monitor what we monitor. We need also to better influence and convince people, because that's never given, and eventually learn to live with climate change, because it's not going to disappear at all. It's worsening. We cannot, even if we stop greenhouse gases, current impacts will continue for several decades. It will just be reduced at some point after 2050. And we need to know better the benefits of this reduction, like reduce air pollution, protecting our water, our food, better social cohesion instead of conflict, and overall better health. Alors, I was pleased to present this to you. Thank you very much for your attention.
Thank you, Pierre. It was really a comprehensive presentation. And before getting to the questions, because we already had several questions, but I also remind our participants that they can write their questions now to the chat screen. Before getting to the questions, you said that you are already in the mainstreaming stage, but I think Turkey, we are still in before that, like we are still in agenda setting stage maybe. So, and you are living in a cold country, is comparing to Turkey actually, but you already developed many health warning systems and health plans uh, in your region, Quebec, and also other regions in Canada. Can you talk a little bit about what kind of health warning or heat health warning systems we should develop also in Turkey? Because we are now in the developing phase of this, and we are trying to tell to local administrations, to health authorities that we need to recognize at least in this stage that heat is really serious problem. And what kind of heat health um, action plans or warning system should be developed, because you are especially in this developing phase, I guess.
Well, it takes time to begin with, of course. Maybe it will be shorter on your side because everyone sees the many impacts of heat waves. But the way it started here was mainly because we had a couple of very impressive floods, and then a high storm the year after, and then interest in the climate began to increase. And right after that, that was at the beginning of year 2000, and right after that was the big heat wave in France. So this was a very good window of opportunity for us to present our intentions in terms of public health, and the government was receptive and decided it was a governmental decision to go ahead vigorously against climate change back in 2007. So it helped very much to bring the budget and the needed attention. So going there is something that needs leadership. So of course, when we're talking about for me, it needs to be nested within civil protection. So any hazards, any extreme event is quite similar in the end. Of course, the public health people should get more involved when it's a heat wave. But the normal way such emergencies are handled in Turkey should be the same, with a special input for heat waves from public health people. You need to get close to the meteorological service because they have to warn people. They have to warn people correctly. There are some messages to be transmitted to the general population. On your side, the public health authorities should also there are groups that need to be taken care of more specifically. You find a greater density of older people, poor people, homeless people, social workers, and firemen. So
I think we have missed the connection, but he will come back. Pierre?
Yeah, I'm back.
Yes.
I don't know why
We have missed part of your answer, the last 2 minutes, I guess.
Okay. I was saying that to implement such a doing a heat health action plan is something important, involving many partners. So you need at the start a political will, a good understanding of those matters between the public health authorities, the municipality, and the meteorological service, and the whole system of civil protection. Because at some point, it's a phased stage intervention. At the beginning of the season, you prepare your communication plan, you prepare your list of people to be contacted during the emergency, you check that everyone knows what to do. And then you begin to check the weather. You need to talk in advance. You don't wait for the forecast to be on TV. You can see those systems coming sometimes 1 week in advance that the heat wave is coming. So a good communication between meteorological service will let you know, is it going to be long? Is it going to be more severe than usual? Is it going to be accompanied or preceded by rain? So that's the kind of information that's quite crucial to determine in advance, is it going to be a huge one or a small one? And then at some point, it really starts. So you send, when you're 1 day before, you don't wait for the heat wave to begin. You start all your maneuvers 1 or 2 days before. So you prefer to have a false alert than miss the heat wave. So 1 or 2 days before, you send all your warnings to the nursing homes, the kindergartens, the hospitals. They have to change their routine. They have to have nursing plans. The doctors in emergency rooms need to be reminded of the basic symptoms and clinical signs. So all this needs to be done in advance. And at some point, we also need to check for the homeless in the street, to check in the very deprived neighborhoods. Here in Montreal, we send social workers with bottles of water and policemen on the street, and they check if they're going well. They call ambulances if needed. So that's the way you save lives in such a heat health action plan. And after that, of course, when you come back to normal, you check, have you done everything correctly? Can you do any better? And now it's a time for prevention. If you see that all your, in Montreal a few years ago, we had over mortality in people known for mental health problems. So we had a program to try to improve their follow-up, to offer them cool places when there's a heat wave, to check on their medication and that kind of stuff. In some other cities, they're planting trees, offering parks in neighborhoods where they don't have any. That's the kind of preventive tools that can be implemented. Some countries, some states in the United States are even offering for the duration, offering to poor people air conditioning. There it gets at 45, 47 degrees. Arizona does that. So they're offering buses with air conditioning on the street, so you can get a respite from the heat. They're offering money to buy yourself a little air conditioner for your bedroom. That kind of stuff is doable, is done in many places already.
There is one question about air conditioning. Now, just after you talked about that, Sevgi Mutlu is asking, I would like to hear more about the misuse of air conditioning in the case of Turkey, where sometimes inside and outside differences are more than 15 degrees. Is there any data, or how is it taken into account when we are talking about health effects?
Of course, you need to be reasonable when using air conditioning, because on the one side, depending on what's your source for power, electric power, if it comes from coal or fossil fuels, you will increase your air pollution. The other thing is to if it's generalized in any given city, it will, by putting hot air outside your home, it increases the overall heat within the city by 2-3 degrees. So it's not the perfect solution, far from it. So you need to be reasonable in setting the temperature inside. You don't need that all day long, that's for sure. So you have to focus. Anyway, most people, even the poor people, when they install air conditioning, it's usually because they're already sick from our studies. They already suffer from the heat more than others. So that's the way it goes most of the time. So the question is about there are some bad impacts, of course. The gas you put into those air conditioners contributes also to climate change. It's a greenhouse gas. So it's a temporary solution, of course. We'll need better air conditioning systems that have less impacts on the environment, on climate change. We'll also need to improve our dwellings so that they're more resistant to heat and cold. That's the same insulation improvement that needs to be done. There are simple measures also that people can implement at home. So drinking more, shutting the curtains and everything at the beginning of the day and opening them at night only. Put off all your appliances at home. So it's not time to cook inside. It's not time to start the oven and stuff like that. And taking showers or short baths is something very useful to decrease the impact, even without air conditioning.
Yeah, there is a similar question related to air conditioning by Sinan Erensu, and he's reminding us that the COVID-19 has been also impacting adaptation efforts, particularly in terms of dealing with the urban heat waves. And he says, I can think of public hazards of using air conditioning during the pandemic because of the virus, maybe, I don't know, transmission.
Yeah, there has been several concerns about that, but basically no studies has proven that it's deleterious when it's well managed. So if the air conditioning system includes some fresh air all the time, it's not turning in a closed system. That's one thing. You need to change the filters. You need also that the direction of the flow does not promote sharing of the air between people. So there are some basic solutions that should be applied at any time in a way to prevent diseases such as Legionnaires, the infectious disease that can be caused by air conditioning system. Basically, we have used it in our long-term care system during the COVID because it was very hot. So we brought in a mobile air conditioning system with the public health advice, official advice to use it, not to send the flow towards the hospital workers, but to direct it otherwise. And it worked well. It didn't increase anything. And similar directives were put forward by the CDC and several other public health agencies.
And also the fans are no longer recommended, I guess, right? During the heat waves.
It depends on the level, because normal temperature of the body is 37.5 degrees. So if you're under that, it's okay. It accelerates the evaporation of sweat, but over the temperature of the body, of course, it doesn't help. And some studies say that it can worsen. But of course, the mix, there are some tricks to use fans also. You can use a little spray to put on yourself, because some old people They don't sweat. It's normal physiological fact that you don't feel the heat so much. You don't sweat so much when you age. So using a little spray of water on you and a fan is a good idea, as long as the temperature, as I said, is under 37 degrees inside.
Yeah, there is one other question about more traditional way of prevention. Hakan Ozan Erzincan is asking, what do you think about suggestion of umbrella, especially for seniors? When they go out, can they take their umbrella against direct sun?
Yes, of course. Any shade is useful, decreases the air temperature around you by a few degrees. As I said before, a park, beside the parking, there's a 15-degree difference. So under an umbrella, I haven't seen any studies saying what's the difference, but I'm sure it's cooler under than without. So I would say that that's a good idea. Yeah, and a hat too, of course.
Yeah, and other question is more about the inequality in the society. Sinan Burat is asking, from the aerial photograph you showed, there are serious differences between the high-income neighborhoods and the low-income neighborhoods.
Yeah.
Are there any programs or initiatives to reduce that spatial difference between those two neighborhoods?
Yeah, well, I mentioned the programs we have. These were mostly pilot, but the next phase, beginning this year, is to promote this kind of approach in all our major cities where the problem is touching more people. That should be the announce for funding will be in September. We hope a lot, but eventually COVID has changed the fiscal situation for most governments worldwide, so I don't know what will happen, but eventually there is our work over the last 15 years has brought the level of sensitivity to those matters much higher in municipal government. So some cities are already doing that by themselves. Other cities will need encouragement, will need work from NGOs in the field to that we stop cutting the trees that we have, the parks that we have, because it's still there. The pressure from promoters to cut trees and parks and build apartment buildings is great, and there are some fights in society about that, of course, but there's also a green movement that is touching many people worldwide in our country, I'm sure in yours, to try to counter those trends. Eventually, we need more tree planting. We need more good urban design, and it will happen at some point, of course, I'm sure.
In Istanbul and in Turkey in general, we are recently talking more about the different vulnerabilities in the cities for floods because of the, the urbanization in these not very suitable places for flood. But I think most of the time the same neighborhoods are affecting both from floods and urban heat island and also the heat waves, right? So I don't know how we attract attract the attention of the authorities about this. But heat waves are not less serious or less dangerous than floods, I guess.
No, they're not. The big difference is there's no, not so much material destruction with heat waves. It's only humans being impacted. While floods, you can have lots of destruction. So
it's more visible, right? So
it's more visible. It's depending on your country, of course, it's also more costly for a number of people. It can be for insurance companies, it can be for governments, it can be for the individual people that will mobilize to get replacement homes and place to live. So that's the main difference compared to heat wave. But one tool that has been very useful in our case was the urban heat island mapping. It was the first to be done. It's not very costly to do. You do that with free Landsat images. You only need to find someone that is competent in terms of ArcGIS and choosing well the pictures of Landsat and defining the classes, but it's less than $100,000 to do a mapping of a large places like Quebec is 1,200 kilometers. The inhabited portion is about 1,500 kilometers up north, and east-west is about 1,200 kilometers. So it's not very costly to do that. I'm sure you could do that for Turkey too. The interesting thing, once you have this map, is that you can type your address and overlay Google Maps with your urban heat island map, and playing with the opacity, you can see what's under this red spot. Is it because it's a parking? Is it because it's a big building? Why is it green? Is it because it's a park, or there's something else? So it's very informative. Once we put the mapping on the internet, the server at the agency went bust because we had 40,000 requests in 2 days to download all this information. Everyone in the province wanted to know, and all the municipalities, the 1,000 municipalities of the province, have downloaded that to see to take that into account in their urban planning. So tools like that are very important to raise awareness, I believe. Media communication training, several, not only that help people, but we have gone to municipal conventions, we went to engineers, urbanists, scientific encounters, presenting all that stuff over a number of years. Sorry. Is useful, and in the end bears some results.
I have another question, one more question about local thresholds. In your presentation, you said that meteorological services is, of course, they are giving us the warning about heat waves, but I think we also need a local threshold for a heat wave, and it should come from mortality studies, right? Mortality or morbidity studies.
Actually, there are two ways. You can, many parts of the world, they only use the, let's say, 97 percentile, and then there's a warning that goes automatically. But what we've done here, and what is done in more and more in Canada, and also in Europe, in France, notably, is that you check in the past what are the temperatures that have brought over mortality. So we checked all the heat waves in the past for this province, and only half of them were linked to over mortality. So we discovered that a heat wave in August doesn't bring any over mortality, while if it happens in the spring or in July, it brings over mortality. And we have checked that for several natural climatic regions. We have 4 such regions where you have to take into account the Gulf of the St. Lawrence River, which is large and cold. You have to take into account the Montreal region, which is basically a humid plain and very hot. So, and the north. So we have different numbers that can be determined based on over-mortality in the past. Endlin has made the same because and you can see huge differences in like for Montreal, it's 33 degrees at day and 20 at night for 3 days. And we weight the days differently because of the accuracy of the forecast. The first 2 days are usually good, and the third day is usually much less accurate. So we have only 10% of the weight for the last day. So when there's such a situation, those numbers being met, we send a full alert to our regions automatically. It's programmed, it's easy to do. Other regions in the province have similar alerts at 30 degrees and 18 or 17 at night. Endlin has some of their alerts at 25 in the north, 25 and 16. They can, because they are highly, they're densely populated, they can detect those over-mortalities much easier than we do. We have a small population, so it's much more difficult. We detect only over-mortality of 50%, which is out of the noise of the natural variability of mortality. While if you've got dense countries like yours or like France or the UK, you can detect 25% over mortality with some statistical certainty. So that's a difference, but it's very helpful because you decrease significantly the false alerts. We got only one false alert per region per year. And that's what people tell us. We want to keep them because it's a good practice anyway. If you get a false alert, you start the system, you run the whole
and
thing.
No harm.
No harm to no one. You're not spending too much money because you stop at some point. You see that nothing happens, but you don't miss the big one. So these are considerations to have when you start such a system. It's a balance. It's not an exact science. You have to balance detecting 100% of the real ones and accepting some false alert meanwhile.
Oh, thank you. So we are coming to the end, but we have 2 more short questions from the audience. Before that, I have one last question about the training of the health personnel, like doctors and nurses. I think you don't use heat stroke or heat death as cause of death, right? Many times. Is there any difference after the trainings related to this cause of death?
Well, what we use in the surveillance system is Allcause mortality.
Allcause, yes.
Yeah, because it's been shown as a very good indicator of mortality during heat waves. Because the other way to do that is to use some coroner or medical information. But to do that, you need to have the rectal temperature when you find the body, or the temperature in the apartment where you found the body. You have to have some criteria to be met, and then you miss usually 50 to 60% of the heat-related deaths. So we believe that during a heat wave, we've done some studies about that, and we realized that during a heat waves, about 40% of the variance in mortality was explained by the heat and not by other factors. So the idea being to check what's happening. Detecting an over-mortality is enough to act because you want to reduce that. You already have determined where are your spots at risk, where you can intervene, where you can help people. You have already warned the actors in the system to be more vigilant about such a potential problem. You've told the nurses to hydrate more, even if they are not thirsty, the old people. You have routines to take the temperature in some instances. You have warned the kindergartens not to play outside more than half an hour at a time. So that's the kind of stuff that when sent the day before, 2 days before the heat wave, can reduce mortality easily by 75%. That's what we've done between 2010 and 2020 in our case. Simple measures. We didn't do much more than that so far. For the future, I think we will need to do more, though.
Okay, thank you. Last two questions from the audience. One is Hakan Ozan Erzincanlı again is asking, is there any study about heat wave effects on animal welfare?
Well, there are. Veterinary doctors are active in that. Maybe you can check on the internet. There are several studies on the impact on cows and pigs, because they, at least here, they're not outside. They're usually in barns with ventilation, and so any power outage during a heat wave is a huge problem for farmers. Because it's too hot and the animals die. It's the same for any pets, cats or dogs that you may have. If you leave them 5-10 minutes in a car in the sun, it easily gets to 40-45 degrees within the car, and you can die in 10-15 minutes. That's quite quick too. So yes, there are plenty of studies about that.
Okay. And the last question is by Sevgi Mutlu, and she's asking, what is the place of the indigenous or traditional ways of prevention in your projects? Like, do you use indigenous knowledge for the prevention?
Yes, well, indigenous knowledge is about the relationship with the ecosystem, and ways of surviving in that. You have to know that only about 25% of the indigenous peoples in Canada remain in hunter-gatherer situation, especially those up north. The rest have moved over the years, over the decades, in small cities and big cities, and they have received normal education in many cases. They work in normal jobs like all of us. So their knowledge base applies to the ecosystems of that region of the country, which is changing very fast. The last time we had such warm climate was 6 centuries ago. Not having written memories of that, it doesn't seem to have transmitted to the present generations. However, they are seeing huge changes. They have been very quick to mention the changes in the north and the changes in habitat, in animals and flora. So what they have developed is more some practical tools to be able to continue to hunt and fish. For instance, they have emergency systems that are being developed so that they can be warned more easily of coming storms around their hunting or fishing places. They have to take into account that the water is not as drinkable as it was before because of the warming during summer. So they are now using technologies. They are using disinfectants, and they bring more drinkable water with them when they leave the villages. So that's a kind of adaptation that they have developed based on what they like to continue to do. But unfortunately, ecosystems are declining too in the north, not only in the Amazon. It's the same everywhere. So we don't know what will happen, but there are specific programs to help them find such solutions for the future.
Okay, thank you. And I forgot to ask one more technical question that Akgün İlhan is asking, where can we find more information about these pilot projects to decrease the impacts of urban heat islands that you mentioned?
Well, the ones that we've done, unfortunately, are available only in French, but in the literature, there are plenty of similar projects that have taken place worldwide that can be found in the English literature. Ourselves, we have published a couple of papers in English about that, but basically searching greening cities and impacts and such words like that, keywords like that will bring you interesting stuff. There is a recent publication by the World Health Organization about that, which reviews the literature. I was involved in reviewing the review, and it gives good information on the impact of greening and the main ingredient of parks and greening in cities. There are two actually. It reduces air pollution quite significantly, and it also is conducive to more physical exercise, which is the main driver of improved health. So active transport, like using your bicycle or walking at any age, in any medical condition, especially for diabetes, is excellent. Many cities are promoting that. New York City began such a program 15 years ago with excellent results, as they are paying the public health system, the city. They're seeing the benefits in reduced costs for the people engaging into active transport and going to parks and playing and whatever you can do in parks. Even just sitting there is good for social interaction.
Yes. And we already have a volunteer for translating or summarizing it from French. So if you send it to me, so maybe we can do it.
Remind me that, I'll be happy. Yeah, we have several publications, yeah.
Okay, thank you. And thank you very much, Pierre, for this excellent introduction for us to the heat health action plans and the health impacts of climate change. And thank you all the participants for being here with us. And I think we will see each other again. Maybe, hopefully, after this pandemic, we would like to welcome you in Istanbul. But
I would love to.
Until that time, we will continue our collaboration by online, at least. And after the summer, we will have several other events with Pierre, maybe. So we will see later on. Thank you very much, Pierre.
Thank you. It was a pleasure.
Thank you. And see you next time, probably after the summer. Bye.
Bye-bye.